So, welcome all, namaste, and a very warm welcome for today's Policy Cafe on Aging with Dignity in America, Community Care, Social Connection, and Healthy Longevity. My name is Kavita Tiwari, and I serve as the Executive Director of Sewa International's Houston chapter. As a pharmaceutical chemist, I have spent many years in drug research before finding my true calling in nonprofit work. Since 2012, Seva has been my home, a community of individuals devoted to surface service and genuine care. Aging is not about living longer, as we just discussed. It's about living with dignity, purpose, and connection. And the numbers tell us that this conversation is really urgent. Today, we have the right people in the room to talk about exactly that. Voices from academia, healthcare, nonprofits, public policy, all committed to shape a better future for our seniors. Thank you for being here. And just as a reminder, we are also going YouTube Live to reach the larger audience that we want to impact. Now it is my distinct honor to invite Mr. Shrikant Gunduvarapu. He's the president of Seva International USA to deliver the opening remarks. A distinguished entrepreneur, a community leader. He has played a key role in advancing Seva's mission of selfless service, strengthening volunteerism, and leading impactful humanitarian initiatives, including the COVID-19 relief efforts. So without much ado, I will hand it over to Shrikantji.
Namaste, everyone. Thank you very much, Kavita ji. It's my privilege to introduce Seva International USA, a volunteer-driven humanitarian organization rooted in the timeless ethos of Seva. That's in Sanskrit, so in English it means selfless service. Founded in 2003 in the US as a part of a global movement that began in India in 1989, Seva today spans over 30 different countries. In the US alone, we have about 46 chapters, more than 11,000 volunteers, impacting nearly 900,000 lives through strong community partnerships. At Seva, our work is deeply community centered, and I would like to highlight some of our flagship initiatives briefly. Our disaster response efforts are among our most critical commitments. We actively engage across all the three stages: rescue within first 72 hours, relief over the next 3 months, and long-term rehab spanning several years, supporting millions of disaster-affected individuals globally. In education, we run two different programs. One geared towards the young school-going kids. It's a program called LEAD, Leadership, Education, and Development. And in this program, we do service-based learning. And another program we have is Aspire, which is an after-school academic support initiative that uplifts under-resourced and refugee children through consistent learning assistance and care. We have about 3,500 students in about 13 plus community centers across the country. In addition, our family services program that we have, it acts as a vital support system connecting individuals and families, especially underserved and immigrant communities, to resources, guidance, and care through a strong volunteer network. These initiatives are not only about addressing the challenges of aging, but about building a society where every senior feels valued, connected, supported, and cared for with dignity. Through community engagement, volunteerism, and compassionate service, Seva International and its family services team continue working towards creating strong support system for healthy aging, emotional well-being, and social connection within our communities. For example, across our chapters, we have several senior meets that happen on every weekend. And in some cities, there are multiple meets happening every weekend. Today, we have all come together with a shared commitment to bring meaningful change in the lives of seniors and families. For that, I would like to sincerely thank all our esteemed panelists, the Policy Cafe team, and our dedicated Seva volunteers for being part of this important journey. Together, let's continue to build a more compassionate, inclusive, and service-oriented society where aging is embraced with dignity, care, and humanity. As a matter of fact, as I was just before the start of this session, I was mentioning to the panelists here, I'm in India. actually attending to my father who is 92 years old, who's aging at home. So I would love to really hear about like aging at home, the nutrition, and what are the other care, I mean, that could be given to elderly parents or elderly who are in their 60s, 70s, 80s, and 90s and more. I mean, so thank you and look forward to hearing from you. Thank you, Kavitaji.
Oh, thank you, Shikanji. That was very insightful. You were able to, share very quickly, but very impactfully the various programs Seva does. And like you just said, we are also invested in the senior care and the communities that we live in. Now it is my privilege to invite Narendra Zambarji. He is the Associate Director of Family Services Initiative at Sewa International, with over 15 years of industry leadership and a deep commitment to community service. He brings together professional excellence and a compassionate social impact. Narenji, it's all yours.
Taji, namaste and very warm greeting to everyone, those who are present here today. It gives me immense pleasure to speak briefly about one of the most meaningful community-centered program of Seva International Family Services, and especially its growing initiative, Senior Seva. Family services is built on providing compassionate support to individuals and families in case of need through case management. The Family Services Program is dedicated to supporting families by providing essential resources, guidance, and assistance to help them during difficult times. While case management provides compassionate support, proactive initiatives are planned to get better prepared through health and wellness initiatives and educational outreach. Within this larger vision, Senior Seva has emerged through our family services experience as a remarkable platform created for seniors by seniors and enabling seniors to remain socially centered, intellectually engaged, emotionally supported, and actively involved in the community life. What makes Senior Seva truly special is that it goes beyond service delivery, recognizes seniors not just as a beneficiaries but as a contributor, mentor, and pillars of community wisdom. It creates spaces for belongings and provide platform for networking through small groups. Through workshops, wellness sessions, and other group activities, the program addresses loneliness, promotes healthy aging, and also provides opportunity for volunteering. Over the past few years, the initiative has expanded steadily across chapters, including Houston, Atlanta, Sacramento, and now in Chicago, touching the thousands of seniors through this meaningful engagement and support. As conversation about aging with dignity become increasingly important worldwide, Senior Seva stands as an example of how community-driven care can complement formal system and build a stronger, more compassionate societies. I thank everyone and I'm looking forward to the insightful discussion today. Thank you.
Thank you so much, Narenji. Thank you for the work you do for Sewa Seniors in Houston chapter and also the team that works all across our country. With that, I would now like to go ahead and briefly outline the purpose of today's Policy Cafe and set some context. By 2034, older adults will outnumber children in the United States for the first time, making this a major demographic shift. Aging is no longer only about healthcare or retirement, it is also about belonging, purpose, dignity, and social connections. Current systems and communities are still not fully prepared to support an aging population in an inclusive and meaningful way. Addressing the challenges of aging requires collaboration across policy, healthcare, legal, advocacy, research, and community organizations for which we have gathered here. So thank you all for joining us. Before we jump into our discussion, it is my distinct pleasure and honor to introduce our esteemed panelists. First up, I would like to welcome Robert Blancato. He goes by Bob. He is a nationally respected leader in aging, nutrition, and elder justice advocacy. His leadership was instrumental in the passage of the Elder Justice Act of 2010, and his lifelong contributions to older adults' well-being earned him induction into the American Society of Aging Hall of Fame in 2022. Welcome, Bob.
Thank you very
Next
much.
up, Of course, of course. Next up, we have Dr. Laura Mosqueda, Professor of Family Medicine and Geriatrics at the University of Southern California Keck School of Medicine. She's also the Director of National Center of Elder Abuse, a federally funded initiative that serves as the nation's coordinating body for research, information, and best practices on elder abuse, neglect, and exploitation. A very warm welcome, Laura. Next, I have Elena Portocolon, Professor of Sociology at UC San Francisco, a leading researcher on aging and cognitive health. Through her Living Alone with Cognitive Impairment project, she has advanced policies and support systems for older adults while strongly advocating for greater inclusion of communities of color in dementia research. Finally, I would like to welcome Dr. Dorothea Vafiadis, a senior leader at the National Council of Aging, where she leads national initiatives on healthy aging, health equity, and systems levels change for older adults. So, with that introduction, I just can't believe we have such an amazing panel here today. We are so lucky to be in their presence. Let's start our discussion now. Just a little bit of context. We'll have 3 rounds of discussions here, starting off with questions to each one of you in round 1 and round 2. Please feel free to collaborate and jump in if you have point while the discussion and the questions are pointed at a specific speaker. But after that, we will try and figure out and get your, one high level recommendation for working with seniors. So with that, I would now like to put my first question to Bob. Bob, you have spent a significant number of time and many years of research in senior nutrition, Older American Act, and aging advocacy. What are the most common nutrition-related challenges seniors face today, in your opinion? And if your work on food as medicine, how do you think that initiative can help seniors?
Well, thank you for the question. Thank you for the invitation to join this policy cafe. And Sewa USA and all your work you're doing. Very interested in your program that you announced in the beginning. I'm also delighted to be with my colleagues, Laura, Dorothea, and Elena. We work together in different capacities, and they are all leaders of their own right and great impact, as you'll hear. So, I'm glad you bring nutrition up as an issue. There's a classic global issue, frankly, if you think about it.
Right.
The issues, the challenges facing older adults, probably the most important one is inadequate protein intake, and which then leads to loss of muscle mass and sarcopenia, and then you end up with an enhanced risk of falls, and enhanced risk of malnutrition, which is growing in the older adult population. The issue of dehydration is very much an issue for older adults. The issue of polypharmacy, where you have the impact of taking drugs and what it does to impact taste and smell and things like that could inhibit people's ability to eat. Something we don't spend enough time on is inadequate oral health and how that can contribute to problems for older adults as they access and affordability. I've long said that the food paradigm in this country is messed up. Okay, yeah. It is so easy to buy cheap food. It's accessible and it's cheap. Good food is harder to get and more expensive to get. And if we don't start changing that paradigm a little bit, we're not going to be making any progress in improving health. Also, we have the issue, as we do in too many of our social programs in our country, an inadequate investment in nutrition at the federal level. You mentioned the Older Americans Act, which is one of the most remarkable federal programs that ever existed. It provides a return on investment every day in what the services it provides to older adults by keeping them at home and independent. But, we're talking about money that has not kept up with inflation. And right now, we're facing a more serious issue over the last 2.5 months with rising food costs and gas prices that impact the ability to provide nutrition services for older adults. So it's clear to me that, we need to step up and do more in this space. Okay, we need to have Medicare do more with nutrition than it does. Medicare Advantage does some of it, but it's not enough. We need to have better coordination between our nutrition programs in the Department of Health and Human Services and the Department of Agriculture. And on the question of food as medicine, I'm glad to see it happening. It needs to get defined a little bit better. You've got food as medicine, food is medicine, medically tailored meals. You got to get the term down to something where everybody can agree on what it is. But what it comes down to, it's customized nutrition that's designed to prevent and manage chronic disease. Okay? It's about helping to maintain the independence of an older adult. It will lower their out-of-pocket healthcare costs for things like prescription drugs and ER visits. It can combat frailty and malnutrition. It can reduce readmissions to hospitals. These are all things that food as medicine can and will do over time. It also helps with cognitive and physical health. And I think what's most interesting right now is that the interest of the administration and Congress on a bipartisan basis to move this issue forward. But where the action really is at the local level. People are experimenting with demonstration programs that are marvelous on how they're reaching the older adults in their community. So I wish everybody well going forward in this space. And thank you for the question.
Okay, Laura, Dorothea, do you all have anything to add to what Robert just said? Alina, you as well? Okay, wonderful. So what I'm hearing from you is how these policies and these decisions can be enacted on ground. So in your opinion, what is the best strategy to take it to the ground level? How does it get in action? Like, yes, we have these wonderful studies. Yes, we have all this information, but for an ordinary organization or a nonprofit organization or an individual, how does it get into action is something that I would, if you could shed some light on that.
Are you asking
actionable
me,
things? Yes, I'm asking you, Bob. Yeah.
All right, I'll start, and I'll be happy to defer. But one of the ways you get action is there's marvelous research that goes on in so many areas of focus in dealing with older adults, but it's not disseminated properly. Okay.
Yeah.
We need to get research into the hands of policymakers so they understand there's a research background to a bill they might be proposing or to a policy they may be proposing. And the other thing that's important is we should be funding more demonstration programs at the local level. You mentioned the Older Americans Act Nutrition Program. That began as a demonstration program, okay, in 6 or 7 states. They tested it out, they discovered how it worked, and it became a federal program. So sometimes if you both disseminate properly to the right people and build on your local experiences and bring people with lived experience into the conversation, then I think that's the right equation.
Thank you so much, Robert, on that very important topic. A good discussion there. My next question to you is to you, Laura. You have been doing a lot of work studying elder abuse and mistreatment, and it just breaks my heart that we have to have this conversation about abuse for seniors, right? Can you please share with us some of the instances of elder abuse from your work experience and how people usually address it? Like, what do you do when you see this happening? So what is your perspective on that, Laura?
Well, the good news, I think, about elder abuse and neglect is that I believe that the majority of it is preventable. But we need to understand root causes. You mentioned the National Center on Elder Abuse. I just want to make a gentle reminder that I used to be the director. I'm now a senior advisor, and my friend and colleague Lori Mars is the director of the National Center on Elder Abuse. I'm in a very lucky position because I'm a physician, but I also am a researcher, and I also volunteer in nursing homes as a long-term care ombudsman and get to see this from so many different perspectives. And believe it or not, some people are uncomfortable with this, but I've come to have empathy. I don't excuse it, but I do have now more empathy for people who end up doing abusive and neglectful actions, and believe that by understanding what drives the behavior, we can prevent it upstream. In no way does it excuse the abuse or neglect. So I want to be very clear about that. The vast majority of abuse and neglect is occurring in the community, not in nursing homes. And the vast majority is occurring at the hands of family members, typically adult children and spouses, not by paid caregivers. We can talk about issues in nursing homes if that's of interest to this audience, but for now I might focus more on communities. As I'm seeing somebody with dementia and we have families who don't understand what dementia is and they think the person is doing it on purpose, the more I can help them come to an understanding of what their loved one may be going through and that they're not doing it on purpose may help prevent abuse in the future. It may turn out that preventing child abuse will be the best way to prevent elder abuse as well. Sometimes by the time I'm seeing an older adult and they're being cared for by an adult child and they seem perfectly fine to me, and I learn if I listen and ask that that person used to be quite abusive to that child when they were growing up. Again, it doesn't mean it's okay to abuse the older adult, but it helps me understand these sort of high risk situations. So what I'm very interested in is the interconnectedness of all of us, that there's too much fear driving what we do, certainly as a society right now in the United States, but also in how we behave on day-to-day, in our day-to-day interactions. And the more we can decrease fear and increase understanding, and dare I say increase love, I think we can really decrease the abuse and neglect that's going on. That said, there's also some really awful cases going on where much stronger action is needed. I was just called yesterday by somebody who showed me a very bad bruise on the face of a person, and people were saying that this person fell and that's how it happened. And there is no way that I believe that. This person has an advanced dementia, is unable to express what's going on, and is barely ambulatory, but everybody was accepting that he fell. And that, that's the kind of thing where it's abuse until proven otherwise. And other people who are living in the same area where he is living are at risk. So we really have to understand a big spectrum, both in terms of severity, causes, which means that there's a variety of answers, but it does mean that there are many ways that we can work toward prevention.
Wow. This is quite something to digest. And I have a personal take on this because we lived in a joint family system where my elderly grandmother had dementia, and my father kind of stepped up as a caregiver for a really long time, and it was intense on him. And he was very, very careful on how he handled her and how he took care of her, and very loving. But I can see that equation totally flip, like you just said. If there was past history of child abuse in a home, that child is probably not as invested now that the tables have been turned. There could be some backstory, and those things maybe can be counseled out of the situation. You can talk to family and work with them, but then again, there are some things that are downright abuse, like willful, right? Not unintentional, whatnot. Wow. Okay. This needs more thorough talk and education for all of us, actually, because caregiver's life is not easy, right? That is also a very hard ask.
100%. And it's not an excuse to be
I
abusive or
100%
neglectful,
agree with you.
right? And there's bad things that happen, sexual assaults, frank physical abuse, the emotional abuse can really take its toll. And the impact is not just on the older adult, but this gets back to the interconnectedness that I'm so interested in. It's on the older adult and everybody who loves them as well, that they missed that their grandma, something was happening, and the impact that it has on the family. And that's why we need to understand the web that's involved in all of this. And I
it's
just
it's not.
sorry, one other comment,
No, go
which
ahead.
is sometimes we talk about cultural things, and I hear just about from every culture. I hope I don't cause offense when I say this. Well, our culture reveres the elderly. I have not met one culture that doesn't revere the elderly, and it happens in every culture. So we have to, I think, come to terms with the fact that anybody can be a victim, and this is harder, any one of us can also be a harmer. And we have to accept that within ourselves in order to really do something about it.
Yeah, I think admitting that there is an issue as a problem, right? And there are ways to get the support to the family that feels that they have no other way. Because, dementia patients are also very kind of, they don't listen to you. They don't follow directions. If you ask them to eat, they'll not eat. So there's a lot of other things happening in day-to-day activities that kind of compounds. Okay, they're not listening. They are just acting up or whatever. It's not that.
Right. And trying to help families understand that it's not willful, that it's not that they're not doing something, it's that they can't be doing something.
Incapable.
And the
Yeah.
other thing I work on is sort of terminology. A lot of people talk to me about behavior problems in people with dementia, and I always reframe it. I don't like that term. It is some kind of behavioral manifestation of suffering. And if we understand it in that way, we approach what might be causing it and solutions differently as well. And I apologize if I interrupted you, Kapita.
No. You're just reading my mind, to be honest. These are things, like I said, I have like seen this in my family, the caregiving, what it involves. So I know how complex it is. It's not like this one is wrong and this one is right.
Yeah.
The interconnectedness of the web of all these layers that are in the relationships when you're taking care of a person who has dementia. I know it's a lot. Thank you so
I've been
much,
a
Laura.
caregiver
That
too.
was
Yeah.
yeah. Thank you. Thank you so much. This is awesome. My next question is for you, Dorothea. You have been a strong advocate of healthy aging, including healthy eating, lifestyle change, chronic pain, self-management, and community-based wellness programs for older adults. And at Sewa, we are so invested in this approach because this is what we try to bring to our senior programs. So in your opinion, Dorothea, what are the most common lifestyle-related challenges older adults face today, especially around eating well, staying active, managing pain, and maintaining daily well-being?
Yes, thank you so much for the question. And I think some of my answer will take what Bob said and go a little bit deeper into the community. But at NCOA, we really like to think of a whole person, healthy aging framework, recognizing that physical health, emotional health, social connection, economic security, and environmental supports are critical for older well-being, older adult well-being. And these elements all interact to shape how well people age. And so I would just say, there are a lot of important lifestyle related challenges, but again, one is especially important challenge is eating well and understanding how to make healthy choices. And you need to have access to good nutrition in order to do that. So I would say, nutrition is not just about food, but it's about dignity and nutrition and health and connection. And so aging well depends on that connection and that nutrition support. And I know, as was alluded to earlier, many older adults struggle to maintain consistent nutritious eating habits. But the struggle is due to a combination of challenges, financial, physical, social. So, in terms of food insecurity and rising costs, Bob mentioned that, food insecurity can lead to real serious health issues. In terms of today's food prices in the US, according to the US Bureau of Labor Statistics, food prices have increased over 3% from February of 25 to February of 26. And when you look at grocery prices just in the grocery stores, so where people are buying foods to eat at home, that has risen 2.5% over the year. So we know a lot of older adults are on fixed incomes, and those healthier foods that are rising in price make it really difficult for low income food to be, for low income older adults to afford that food. And so what we find in terms of challenges is many are making choices between if they can afford their rent, can they afford their food, can they, pay for their medications or their prescriptions, or how does that affect their activity level? And so it's very much about the whole person and all the different elements in terms of their lifestyle. And just to take it a step further, I would say, in terms of the access point, we know that 19 million Americans live in low-income areas with limited access to grocery stores or markets that can provide the food they need and the choices that they want based on tailored needs that they may have. And older adults are especially vulnerable because frequently they can't get transportation to be at those places where they can purchase the foods they need. They may have mobility barriers to make it even more difficult. And then you think about locations such as food deserts and rural communities that are really remote. So those are many issues, and I think some of the solutions are at the community level. We see things like food pantries, congregate meal sites at senior centers, home delivered meals. Those are some good things that are happening, but they do need to extend their reach, and they need more support and funding so that older adults can have reliable access to nutritious meals, while also, those aspects also tend to reduce the social isolation. So if you're going to a food assistance pantry or you're going to a senior center, you're going to be having that social interaction, which is also really important. So I think, as we're considering the problem, how do we think broadly about age-friendly communities and local food partnerships that can bring those healthier options to the people that are either in the underserved areas or who are, reluctant to get out of their homes. And I would just add one more piece where we know older adults, 70% of them have 2 or more chronic conditions. So things like living with arthritis or chronic pain, maybe, some cognitive decline can make cooking difficult. And so as much as possible, there are ways to cook easier or have counters, at the right levels for people, or have things so that they're really accessible. Certain kinds of utensils where if you have trouble gripping, they're available. I mean, there are things people can do, but we do really think that there are so many challenges with older adults that live alone. They might want to skip a meal. They may feel uncomfortable cooking for one. So there is a lot of, research, as Bob mentioned. Research is needed, but there has been some out there linking the food insecurity, the nutrition insecurity, and social isolation. See, there's a question.
Doris. This actually is so many layers that contribute to this issue, right? It's not just the food, like food deserts, right? And access to community programs. I see a very good example that is happening in Houston. Is there is a wonderful center, the A-Leaf Community Center. If you guys want to ever look it up, they have a very nice senior meal program, and I'm sure there are several programs like this. So every Saturday, and I think not every Saturday, I think every day of the week, in the first half, they will have a mahjong class, and they have a social Zumba class, and then they're all fed. They all get breakfast there. So I'm not saying that that's very high. It's mass cooking, probably some processed food, but at least they get to come out and eat together and interact with each other. And the social isolation piece and the food, one meal is taken care of. So initiatives like this, I think, which kind of, just make sure that you can hit all these spots if you think of as a solution that is kind of, blends in, like come out, get a meal, and go to the food pantry, and you'll meet your friends there, and there's an activity there for you too. So, we all have to think creatively when we are addressing one of these. Can we hit other goals as well? Not just the food, but the social interaction piece. Yeah, and congregating as a group. And there's a different dynamics. I have a wonderful example when we did a nice Diwali celebration, which is a South Asian function. You've probably heard about Diwali. So we were all part of that. And what I saw is that day, the seniors who are usually taking a back seat, it was a seniors Diwali. They were the one who were organizing it. They were the ones who were running the menu. They were in charge of the catering, the event. And when I saw them, I felt, how did we not look at these people in this light? Why did we always kept thinking that they are seniors? They're not seniors. They cannot be just put in the back shelf because they are a certain age. Yeah. And that, I think, mind shift needs to happen in the community. And Bob, to your point, the protein piece, because you can eat potatoes all day and feel that you're full, but what your body needs at this age, as the food and as medicine piece, right? That education, I think, needs to go down if we can work collectively on that, and maybe we'll get back to you and learn a little bit more with you on this, on how to educate what right nutrition looks like at this age. Great discussion, guys. Thank you so much, Dorothea, for this input. Alina, my next question is going to you. Your research has...
Laura, at that point, I am sorry to interrupt
Please,
you.
John, please. Yes,
Oh,
go
I
ahead.
was just going to ask Dorothea, one of the things we don't talk about that much in nutrition, and I was wondering to get your input, thank you, Elena, is the act of feeding somebody. For older adults who need help to get fed, it's such an intimate, beautiful thing that can happen, but it also can be ugly in terms of the way it's done. Do you have any thoughts about kind of, showing our respect and humanity to a person by the way we feed them? I'm thinking about, for example, nursing homes where they'll just line up a bunch of people who need to be fed and, sort of
shoving it
and
and yeah.
I appreciate that comment, and I agree that there's a way to do it, with dignity. Our work here focuses on free living older adults, so we don't have a lot of work directly with seniors in nursing facilities and with clinical care facilities. But I do think that, there's a lot of room for improvement, and I do think that's an important issue. So I appreciate it.
I think, Dorothea, to your point, and Laura, you had mentioned it earlier, all of these things we are talking about, we can talk it in the nursing home setting completely as a separate topic, because I think that is another beast on its own. There's a lot going on, and unfortunately, a lot of us really don't have any experience unless you have a senior living in a nursing facility. If your seniors are at home with you, you have a certain set of experiences, versus if you have a senior living in a nursing home or a care facility, senior care facility. I think that is also a piece of education that we have to address, like what it means, what it looks like, what really happens, and what our expectations should be when we are evaluating whether our seniors need to go a nursing home or they can age at home with your family. Yeah. Okay, perfect. Alina, my question for you is, your research is focused on, Alina, on older adults living alone, including those experiencing cognitive impairment. What are the major risks faced by seniors living alone with, for example, dementia or some other kind of cognitive impairment? And the second part of that question is, based on experiences, Alina, what are the challenges you have observed in real life when you have been doing your research and your work?
Thank you. So the major, can you hear me? One, two, three.
Yes, we can.
Yeah, very. The major challenge is that the policies, programs are still designed to support caregivers and people with dementia who live with others. So the policies have not kept up with demographic trends. And and just to give you an idea, in 1970, it was very common. Living alone has increased exponentially, and living in a family with children has more than halved between 1970 and now. But the policies are still focusing on the household, on the family living with others, and so then people who live alone, older adults who live alone with cognitive impairment, are excluded from really important policies that are actually designed their intention is to support the most vulnerable people with dementia.
Right.
But in reality, they're supporting the caregivers and people with dementia who live with others. So there is a major disconnect. And like Bob was saying earlier, there are really great national demonstration programs that are extremely innovative. And in the dementia field, there is this program called GUIDE, Guiding an Improved Dementia Experience that has been
Mhm.
launched 2 years ago and has been implemented right now by 500 organizations all over the United States. And it's very much supported by the current administration, which is great. So it's not threatened at all, very supported. And this program guide is focused on injects really good resources to people with dementia and the caregivers. So like self-assessments and other help with medication management, respite care for caregivers. So around $2,300 for caregivers to get respite care. But what about the person living alone without caregivers who really
I
needs
agree.
with dementia
Yeah.
on top of that?
Yeah.
No respite care, no extra. And well,
Mm.
these are the people who really need a lot of support. So, 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 so it's really important to raise awareness about the fact that living alone is extremely common in old age. A third of older adults live alone. Adults age 65 and over live alone in the US, but this percentage really spikes with age. So, for example,
Mhm.
over 40% of adults age 85 and over live alone. I repeat, over 40% of adults 85 and over live alone. And we're talking
Wow.
about people of any race and ethnicities. And living alone in very old age, it's almost mathematical, comes with chronic conditions like dementia, cancer,
Right.
combination, multimorbidity, and living alone in advanced age is a really good sign of social isolation and having
Yeah.
inadequate support in the US. But also,
Mhm.
I notice in India is happening more and more. I notice,
Yeah.
violence in older Indians in India living alone. So it's a really global trend, and
Mhm.
and so it's really important that policy keep up with this trend. And so in terms of, for example, I can give you some examples. So in terms of social isolation, I spent time with an older Indian man living alone with cognitive impairment here in the Bay Area of San Francisco. And he was quite isolated. He kept on asking me to go to lunch with him, dinner with him. He asked me to go and pick the medicines with him. And he was waiting long waits to try to move to another place. He was extremely isolated, and for him it was really important. He was lucky that he received a really good home care aid because he was on Medicaid.
Mhm.
But again, only 21% of older adults living alone with cognitive impairment qualify for Medicaid, so qualify for a
Wow.
public home care aid, a
Mhm.
fraction. Most people living alone with cognitive impairment do not qualify for a home care aid, which is really important when you live alone with cognitive impairment. In his case, his home care aid, he had a really good relation with the home care aid, and also this woman was cooking with him, he was also giving company. So, but it was really, it was really, really great. And like other panel speaker mentioned, polypharmacy is a major issue when you live alone, especially with cognitive impairment in old age. And research from myself and my colleagues, we reported that people who live alone with cognitive impairment are much more likely to have to take high-risk drugs. Imagine insulin, also
Mhm.
barbiturates, high-risk drugs without any help. And for me
Wow.
personally, is that not in general, not only also present, is a
Mhm.
violation of human rights. If a person is taking high-risk medication and doesn't get any help, then you're really endangering, the system is endangering their lives. And I can give an example of a Latino man, isolated, no children, very nice man, very, very nice man, diabetic. And he had a friend who arranged his very complex medications. But the friend, the only friend he was relying on, guess what? Needs to have knee surgery. And so she needs to stop. And also the friend started being quite overwhelmed by taking care of him. And even though he is in a really good healthcare system here in the Bay Area, and also he went to even to the emergency department for some for heart issues. He kept on asking to his doctor and even to his diabetic doctor, please, I need help with managing my diabetes medication. And he was not getting any help. The only way that he managed to get help was that he wrote with me and him wrote an email to the primary care physician and to the diabetic doctor saying, as you know, I live alone, I have diabetes, I have a medical diagnosis of Alzheimer's disease, and I need help with managing my medication because if they're messed up, I might die.
Right.
And
Right.
I'm writing this email with the support of Elena Portacolone, who is a professor at University of California, San Francisco. This is her cell phone number. And guess what? Then he started getting a visiting nurse helping him.
Good for you, Elena. Good job.
Yeah, but this was exception. But you can see what I was saying
The
earlier.
system isn't built like that.
The
You have to
system
fight.
is not equipped to
Yeah.
track living alone and cognitive impairment together and to give some fast track support to these people, unless there is some major intervention of an advocate. In this case, it was me.
Right.
So that's where we are.
Alina, this is so close to what we see every day. Our family services volunteers routinely find such cases when they are dealing with the community. I'm just thinking aloud here is like, for example, if a senior is isolated and they have some cognitive decline, but not really far out, how many hours in a week should someone, I'm talking on behalf of our volunteers here, because I know they curate such programs and try and visit with seniors who are isolated, either to take food for them, either to just go and have a quick chat. What, in your opinion, collective, all of you, a question to all of you is how many hours should we think as an organization that Sewa should say, okay, this is our protocol. This is what we need to do. If we find someone who is isolated, is struggling, is having a hard time mentally, socially, all aspects, even nutrition, for example, Bob, right? So trying to bring the nutrition piece, if you're taking food, but dropping off food like Meals on Wheels does and just having a quick wellness check is one thing. Trying to build in some social interaction meaningful. So as per your expertise, what do you think? How many hours we should budget in each week for our families if we are visiting someone who's senior and declining? And anyone can start.
I could start if so.
Sure.
I'm actually I love volunteering, but at the same time, volunteering is not enough. Because volunteering, it comes with ebb and flows. There are strange power
Sure.
dynamics because the person is not paid, so they serve when it's possible. So I think that volunteering is good in order to connect the person with with professional services. So the
Okay.
volunteer be the advocate, like I was in the case of this man,
Yes.
in order to connect the person with stable
Services.
professional services. And in terms of people living alone with, say, mild cognitive impairment even early dementia, what is beautiful is that these persons do not need many hours, maybe
Okay.
one each day.
Okay.
But what is important for this population, also we estimated 4.3 million older adults
Wow.
living along cognitive impairment in the US, very diverse racially and ethnically. So 1 hour of a person, possibly the same person of a
Yeah.
couple, so that the person
Mhm.
doesn't get confused. Coming each day for 1 hour makes a really big difference, and maybe do some
Wow.
basic course, because for the
Yeah.
person it's good to have someone regularly checking on them and helping them with things that sometimes are not that difficult, like setting up a meal or taking out the garbage, looking at the bills that arrived. So,
Sure.
so what is beautiful, like, echoing Bob um, reflection is not that expensive, but makes a really big difference.
Thank
You
you,
know,
Elena. That is awesome. Go ahead, Bob.
yeah, it's interesting because I was just down in Houston speaking at the Bridges conference
Okay.
in on May 8th, I guess it was, and it's a big
Mm-hmm.
elder justice conference. And the conversation about people living alone and the relationship to elder abuse, as Dr. Mosqueda well knows, the cases of self-neglect that are growing in this country are a
Yeah.
direct relationship to living alone in isolation and loneliness. And, I don't know if it's a question of how many hours per se. It's what are you doing with that time, with that person.
Yes.
You
Mm-hmm.
know, the safety check that's the Meals on Wheels provides is very important. Okay, that could be a very short period of time.
Yeah.
But if it's a matter of engaging in conversation and going deeper around a safety check or doing something more to make the older person feel connected even to you for that short period of time, I don't think you can put an
Sure.
hour limit on it necessarily. I think you got to play it by the circumstance that you walk into, but it should be
I
done.
agree.
No question about it.
Thank you.
Thank you, Bob. Laura, do you have any thoughts?
Yeah, a couple. I mean, unfortunately, the same things that make an older adult both need and then accept care are the same things that make them vulnerable to bad actors coming in. And when I heard the
100%.
examples Alina was giving, my mind was like, oh boy, I'm glad it was a good caregiver, because this is also somebody who could end up getting them to sign their house over to them because they feel
Yeah.
beholden. So it's
Yeah.
like no good deed goes unpunished, right? There's always people who take
Yeah.
advantage in that way as well. The other thing I just want to comment on sort of generally is just in how we're talking about older adults as others. So I'll say I'm 66 years old, so I am one. And
Mm-hmm.
and it isn't just what we want to do for somebody, it's what does that person want? Some older adults are isolated because that's the way they like to live. And I
Oh,
just
yeah.
want to also think about how we respect what that person wants, what their values are, what their goals are, and that we sort of take it from a position of humility in terms of understanding what's important to that person
And
and letting
respecting that
them,
person's needs. Respect
yeah,
them in that. Because
respect
I
it,
don't think,
listen, and let
yeah,
them guide us. Mhm.
yeah, because the last thing you want is somebody just trying to come and take over your life because you're a senior. So help, listen. I think listening is a huge part of it. Listen to what their needs are. Dorothea, do you have a comment for this?
Yeah, I mean, I would agree with what Laura said, and I think we know, well, older adults are not a homogeneous set, right?
Mm.
So, people in their 60s might have a different outlook than their 70s or 80s or 90s. But I know that older adults really value their independence and their ability
Ah,
to be independent. So, as much as, even with my own mother, if I want to come in and help,
my gosh, yes.
I don't need your help. I'm self-sufficient. But
Yeah.
is she really? I mean, that makes it difficult to see, well, when is the point where maybe
Threshold.
some help
Yeah.
is, yeah, what's the
Yeah.
threshold? So,
Yes. Same with my mom. She will fight me tooth and nail, says, oh, I can do everything. You don't have to do anything. So
Yeah, and I just want
it's an
to,
act of love. Yes,
yeah.
Laura, go ahead.
so I'm sorry to interrupt. I just want to tag team with Dorothea, which is really heterogeneity is a hallmark of aging. The older
Yeah.
we get, the more different we become. Give me a room full of 3-year-olds and I can predict their function pretty well. There'll be some outliers, but give me a room full
Yes.
of 93-year-olds and you're going to see incredible diversity in terms of physical, cognitive, social, emotional, and spiritual aspects of their lives.
100%. All those lived experiences make them so diverse. At 3, you only live 3 years. So let's just say it's food, mom, and fun stuff. That's your common denominator. Okay, wonderful. Thank you, guys. This has been so amazing. Going on to a round 2 of questions, Roberto, this is for you. How can federal programs, state agencies, and community organizations coordinate more effectively?
That was for me, right? I'm sorry.
Yes, yes.
Okay, great. Okay, good. Well, first of all, coordination is vital at this point in time to successful programs. Why is coordination important? It lowers administrative burdens. Okay, it
100%,
can
yes.
close service gaps. Okay, it can lead to better use of resources. Now we're in an environment where getting new resources is difficult, right? I mean, we're fighting to hold on to what we have. But if you can demonstrate that you can use your existing resources more effectively through coordination, it could lead you to getting additional funding. Okay, but it's a matter of, communication is key to coordination. Identifying where the need is and where the solution would be best done. Okay, and to me, and I work in this field a long time, I know that the entity closest to the people, if you're doing services, doing programs and things like that, that's where you should concentrate. Okay, community-based programs, relying on those programs that reach the people the closest. We don't leverage enough local expertise in our work in coordinating programs and services. We should do more of that. Okay, and I'll give you one good example. We're involved in a project that led the Centers for Medicare and Medicaid Services to adopt for the first time ever a malnutrition quality measure in hospitals. The goal there is get somebody in a hospital, get them, if they're diagnosed with malnutrition, give them a care plan while they're in the hospital. But when they leave, they need to connect to a community-based nutrition program to avoid being readmitted. Do you realize how few hospital systems connect with anybody in the community, like a community-based nutrition program? We're spending most of our time trying to build that bridge between those two entities. So communication is very, very important. And I think the last point I would say is that if you follow the growing number of states in our country who are adopting master plans or multi-sector plans on aging, you look at their language of these programs, many of them talk about this very issue, how to coordinate better between the federal and the state and the local. So they get it, okay? And it's just about time Washington picked up the tone a little bit better too.
Yeah, I agree. And when you're talking about communication, Bob, how do our seniors consume information is also very important. But at the end of the day, they are the end goal, right? They are the ones who need to be able to absorb this information. In your perspective, how is the best way to communicate with them? What's the best experience that they can have?
I'm not sure there's any one, but Dorothea would agree with me on this one. I think the trusted entity at the local level is very important. Going to a senior center, going to a congregate nutrition program, and talking to the people who run those programs, the staff people, the frontline people, the volunteers that are there, they can convey information and it'll be listened to because they're viewed as a trusted entity. Okay. People forget sometimes that local news and local coverage of things is where an older adult would be interested in getting information in that level. What we want to work on is, but we have to be very careful, as Laura knows, about, getting too much into the space of AI and other forms of information that may or may not be helpful to an older adult, depending on how they use the information. And so everybody's looking at that to see, how do we make it consumer friendly, all these different AI vehicles that are out there for information. But I think it still comes down to a trusted entity, and I think it comes down to family and, things like that. So I think that's one of the best ways to communicate with an older adult.
Okay, so trusted partners and people that they are more likely to see, for example, the news channels and the news media. Yeah, perfect. Thank you so much, Bob. Laura, my next question is for you. What kinds of training do frontline workers, healthcare providers, and community volunteers need? And there is a selfish need in this for us as the organization that proactively is working with senior communities here. We want to be prepared as Sewa International to be able to serve these individuals better. So, what do you think, in your opinion, are the best trainings that we can go for?
Well, so I think people need to understand what is normal and common aging and when something really isn't, is amenable to some sort of treatment. So I always feel like when I'm practicing as a physician, my job is to help my patients be their best, whatever the best may be for them. They may be,
Correct.
have terminal pancreatic cancer and at the end stages, or they may have dementia, or they may be aging very well, but everybody has a best, and am I helping them reach that? So anything we can do to support healthy aging, understanding that many of us will not age in quote a healthy way. I'm not a fan of the idea of successful aging because I hate to think that I fail aging, but it's just again sort of trying to be at our best and what can support that. I think anything that addresses ageism is very helpful, and I think important training has to do with helping us understand our own biases and our own assumptions about aging. I was just a few days ago giving a training for a group of police detectives who are, mostly young, more often than not male, and in doing their jobs, they have certain preconceived notions about older adults. And I only half jokingly say that if you ask a police officer if they'd rather go in to a dark alley with somebody who may have a gun or into a nursing home, they'll go with the dark alley, because that's what they're trained to do and that's what they're more comfortable with. So I think really understanding our biases and assumptions about aging is a very important part of training, and beginning to understand when things start going off, when the wheels start coming off, and catching it as early as possible to see what can be done. We've been talking about connections and interconnections, but if you wait until there's a problem, that's the hardest time to form those connections. So to me, this is an intergenerational issue, and anything, aging is intergenerational. We start aging when we're in the womb. And so, separating, and then we sort of separate older adults into people over the age of 60 or 65. We don't take any other age groups where we do 30 or 40-year chunks as though there's nothing different that happens between the ages of 60 and 100. We wouldn't do that from 0 to 40 or from 20 to 60. So there's so many built-in biases and assumptions that mean that when we are serving as volunteers, which I do in nursing homes, et cetera, that we may overly accept things without questioning them. Whatever we see the most of sort of becomes normal in that bell-shaped curve. I was talking with a group of people who investigate elder deaths in general, who work with medical examiners. And we were talking about whether or not they're seeing people who may have been neglected to death. But it has become so common for them to see older adults who are severely malnourished, maybe with pressure sores, dying in horrible circumstances, that for them that's become normal. It's a horrifying thought, but it is the reality of how things are. So I think when it comes to training, we need to really help people understand, no, this is not the way an older person should die. And this deserves looking into and understanding the circumstances. So sorry to take us down a deep turn there, but I think we have to acknowledge that it's really happening in order to do something about it.
Okay. Thanks. That's deep, Laura. And I think we as an organization will probably reach out to you and also other panelists in this room. So just to understand what are steps 1, 2, 3 for us to be more prepared to handle this in the communities that we serve, right? Thank you. Dorothea, so I'm just trying to see if when you work with the communities that are looking into like the senior communities, how these various habits, healthy habits, pain management, managing of a healthy lifestyle, what makes these community programs effective in helping seniors make real lifestyle changes, and how can they be sustained? So when you're trying to design and look into these various programs, which are the things that make these programs effective? What are the hallmarks, right? And how can we sustain this over time? And I know funding is a huge part of it, but I would love your take on this one.
Yeah, well, thank you for the question. I think there's some things we know, and there's still a lot that we're learning. But when you think about an issue like pain, pain shouldn't really define the way we age, but we know pain is a common chronic health challenge that older adults face, and it can do things like limit your movement, interrupt your sleep, make everyday activities like walking or socializing feel overwhelming. So, that's an aspect of quality of life that we think healthy aging programs or workshops, evidence-based programs are designed to help older adults improve quality of life. And we found that when there's a program that considers the whole person, that's really what makes a difference.
Okay.
So again, the holistic approach is really important. And I think managing pain takes more than medicine. It takes connection, confidence, and support. So we do have some experience with managing pain in a pain program, when we know that the peer-to-peer interaction with people and community programs that are looking at an issue that's so personal, like pain, is really important to have that peer-to-peer interaction, because as we were saying earlier, people don't always feel like they can trust to talk about things that are so personal. But if you find someone who can share in that common experience, that really makes a difference. So I think, the peer-to-peer interaction is important. And then with pain, we talk about focusing on mindfulness, focusing about setting goals, trying to have, those kinds of things are more effective when you're doing it with a partner or companion. And I think the best programs are the ones that complement medicine by helping the patient have information, but also understand, like we're saying, medication can increase dizziness or falls if you're not doing it with control and in a safe way. And so learning more about how to manage pain through a complement of ways can really help patients feel confident that they can manage their own health. I think another thing, that is important today is that a program, offered in person is really important, but sometimes even having that ability for telemedicine or teleconferencing and Zoom programs can make a difference, because some older adults, as we said earlier, don't have transportation. They have limited mobility, or they may have geographic barriers. And sometimes having it be remote or on the Zoom or a platform like Teams, you can have companions join you that may be living somewhere far away. My cousin in Arizona could join me. I live in, Virginia, but we're on a Zoom aerobics class together. Well, that's great. I have that time. So those are some things that could really help. But I think that peer-led can be a way of sustainability, right? If a peer is learning how to lead a class, you have that peer-to-peer interaction, then that can help with the sustainability of a program. You may not always need, a licensed clinical expert to run something. You may need minimal training, and that could really help. So those are some thoughts I have.
Fantastic.
Yeah.
Oh, no, this is just resonating with me at this point so much. We actually have a Zoom senior chair yoga class.
Yeah, there you go.
Yeah, so all these people are in their comfortable, safe areas. They don't have to dress up, don't have to drive anywhere. They're just in their workout clothes at home, and it's chair yoga, so it limits the barrier of being super flexible, and you don't have to, twist yourself in a position. You can sit and do it comfortably. The idea is to make it accessible. For me, this is accessibility. On the level of, okay, nobody's judging me how I'm dressed or how my hair is today. I can just sit here and do this. And those things sometimes are the biggest. You may not think it is a big deal, but it is a big deal sometimes, right? And you don't want to just make a whole thing about going to a class somewhere, but do it remotely, like you just mentioned. Peer mentoring, I think we have seen it work beautifully. So many of our seniors are coaching each other. They have a Zoom class at 6:30 a.m. in the morning for yoga. So 6:30 a.m., they're all up early for some reason. You can't catch their naps long enough. So they're all up, they're participating. But this model seems really something that has worked for us. But yeah, I think, the more we learn on how to develop it and expand it to more activities, for example, pain management and other things, right? Mobility. Those things give confidence, right?
Yes, I agree. And I think, we've had a pain management program that one of the units was, if you're doing it in person and you're able, visit your local pharmacist and talk to the pharmacist, because that's also a trusted source of information. But if you're doing it on Zoom, we found that pharmacists and pharmacy students at universities, they will join a Zoom and they will have conversations with older adults all about, medication, throwing away meds that are expired, where to find things in the pharmacy that can help, like canes or cold packs or the right kinds of over-the-counter medicines. So I found that, the experts are really generous with their time, and to be on a Zoom, they'll do it if it's helping others. It's really great.
I think Laura has a
Well,
point
it
there.
just also strikes me. Oh, sorry. Is it okay?
Go ahead, Laura.
Yeah, that an opportunity that Sewa has is for intergenerational. The peer-to-peer is good, but intergenerational opportunities I think are also great. Going both ways. Many young people are not exposed to grandparents. They live far, far away, etc. And for them to develop a meaningful relationship with an older adult, and for an older adult to have the social interaction with a younger person, seems like a wonderful possibility for Sewa.
Awesome. Bob, a question for you. For example, when we are talking of nutrition, is there a resource where we can for example, a cooking class kind of situation, right? A food and nutrition where we can dive into on nutrition-based education, simple recipes, because that's something that you all or your agencies have vetted, right? Protein heavy. Majority protein diet or something like that. So those resources are something that I think it lends to itself, right, to share with the adults that we work with.
Well, we may have to provide you a full list at a later point, which you can use effectively. But I think, first of all, in the Older Americans Act, the law stipulates that you get a meal and nutrition education. It's to be provided every day. So, the Older Americans Act has an Office of Nutrition and Administration for Community Living. You should use them as a resource. The Department of Agriculture has many nutrition resources for the programs they administer, like the SNAP program. What I find interesting, and I'm interested to see, how this develops, is the Secretary Kennedy's new call for nutrition education to be part of medical school curriculums. He's made a very strong point about having that brought into it, which I think is a good place to begin, particularly if we could combine that with greater support for geriatric medicine and geriatric doctors. If we can combine these two, it could be an interesting way to help both areas of focus. But I think the federal government's got plenty of resources. I'm more than happy to share some of the ones that we use. I just can't give you the citation sitting here in the Zoom, So.
Absolutely. We can have that whenever you're ready to share it with us. Awesome. Thank you so much, Bob. Okay. Elena, my question, I think we've already talked about. Give me a second. I lost my thought here. Yes. Okay, Dorothea, this question is for you. I think we have already gone through this. Okay, perfect. I think with that we have wrapped up our second round of questions. Quickly, I just wanted to take 1 minute from each one of you, and I can just go across the room one by one. Looking ahead, if you would recommend one priority for the next generation of aging policy and community actions in the United States, what would that be? So anyone can go ahead. One recommendation for the policymakers, what would that be? Dorothy, I want to go first.
Well, there's so many. I think, I would agree with, I think, even though we talked a lot about lifestyle, I do think that looking at Medicare and expanding Medicare coverage so that it does address more issues and medications that are important to older adults, it's critically important. So I do think expanding access to Medicare is critically important, and I would just go with that one.
Perfect. And that's the burning question. Yes, go ahead, Bob.
I'm going to read something on principles for the future for aging. Value independence, promote personal security, encourage personal responsibility, recognize interdependence of generations, provide a safety net to support vulnerable populations, recognize and respond to America's growing diversity as they age, and ensure the quality of life of all Americans as they age. Now, I didn't come up with that. This came out of the 1995 White House Conference on Aging. That I had the role of being executive director for President Clinton. This is what we were thinking 30-something years ago. And you know what? Some of it is still relevant today. So
Still relevant.
And Bob, do you think we did hit some of those benchmarks that you guys decided in 95?
We've hit some of them, but not as many as we would have liked. And, I think, it's a framework. You've got to be, there's an old saying that how you frame an issue today can determine how you handle it tomorrow. And we should be 100%. Thinking that way.
Thank you so much, Bob. Alina?
For me, I would like that the future policies are that diversity, the idea of diversity also includes diversity in living arrangements. And with living alone in old age as a living arrangement that requires extra care, extra support. Some people who live alone in old age do it really well because they got enough resources and they planned in an appropriate way. But the majority is really going day by day and dealing with mounting challenges that are really impossible to manage alone. And the reason is that there are no services tailored in the US for older adults who live alone. And I can see the difference. I can see that, for example, in Sweden, I don't see the same struggles of people living alone in Sweden. And why? Because in Sweden, there are home care rates that are provided, especially when you live alone. Same with Denmark or also Japan. The other countries have got a special policies, especially if you live alone, if you just become a widow or a widower. So there is this attention, but in the US, we are not there yet.
Yeah, we lack a safety network for our seniors, right?
Yeah. And when you live alone in old age, often you really need a safety net. Because it's just harder to be proactive and to think about everything that you need to do. And so it's very close. It's really likely to become socially isolated.
Or we all need an Alina in our life who can jump in and advocate on our behalf. Laura,
I need
it's for you.
Me too. Yes.
Yes, we'll be there. We'll be all there for each other. So, Laura, you're next.
I think we need policies that encourage and support and sustain community relationships, and for people to remain involved in the community, and for all of us to remember that if there's a nursing home or assisted living, the people who live there are in our community, even though we don't see them.
Yes.
So the sort of that reaching out, and I think there's a variety of policies that can encourage support and sustain community relationships that go across generations.
Can I throw one more thought in, just because it's on my mind, and it's not intended to be a political or partisan statement, but I think going forward, anybody who's a voter needs to understand how to vote in their best interest and in the best interest of their families. Okay.
100%. And that includes, yes, and that includes your seniors. Don't forget your seniors.
That's
so
I'm especially the seniors, because
especially the seniors, yes.
They have as much at stake as anybody else, if not more so. And so it's time we started doing more both voter education, engagement, ultimately voting in our best interest.
I would love to see some of our potential candidates in upcoming elections in November put out a policy statement focused on what they're going to do for seniors. And I think that's where the advocacy piece comes in. If we call our representatives and say, I hear so much about this and this and this. What have you thought about? How are you going to support the seniors? And it's a selfish interest for me. I'm aging, my parents are aging. If we don't fight the good fight now, I don't think anything is going to change very, very soon, right? So advocacy, I think, is also a huge part. And you guys you play a huge part by all these conversations you have with all of us. People who are on this Zoom call and who are listening into the YouTube are going to see this as a piece of actionable thing that they can do. Requesting change, standing up for themselves, voting in the right way. Okay, perfect. I have a couple of questions that have come in. This is from one of the audience. They mentioned that I observe many men prefer to stay at their own houses than senior living or in their children's home. How do we deal with this? And it's specifically said men, so I'm assuming they are single seniors, men. Do you all have any idea on how to respond to that question? Bob, should we ask you? You're the sole representative of the wonderful gender here.
I'm going to say, first of all, thank you for inviting me for Gender Balance today. We appreciate that. And but secondly, not only am I a panelist today, but I'm a subject matter expert. I'm 75 years old. And so I am in that conversation that you're talking about. So do I think about where I would want to be living? What was the choice? Was senior living thing or
yes, that was the question. Senior living or in the children's houses? Even that, like men want to go solo.
Well, to some extent. I mean, I don't know if that's it's like everything else we said earlier. We're not a homogenous population. A lot of different circumstances that go into different things. I mean, if my daughter invited me into my house and I had choice between that and senior living, said I live with my daughter. So it all depends on a lot of factors that go into it. But I'm curious where the data comes with that question, because it's an interesting question.
Yeah. Another question that I have. So Bob, this is for you again. So I'll keep you in the hot spot. Perhaps we must come up with a metric to add something that is social development. Let's say something that we can do to free up more people to help with seniors. I think that's a comment more or less, but I think they're trying to ask is, okay, I have to understand this question here. Well, I'm going to skip this one, Bob, because I can't understand what they're trying to put across. There's another question that I have for Dorothea. Dorothea, proper nutrition for residents is not addressed by the communities that they are living in, right? Senior communities, for example. Is there any comment by the panel, all of you, from this? Is nutrition piece taken care of and folks are moving into senior homes? And Bob, I think also relates to your input on having a specific kind of diet to preserve your muscle mass and protein intake and all that. Do you all see this kind of thing followed in the senior care homes?
Well, I can just say, I think just personal experience with some relatives who are in senior homes, there's frequently a dietitian on staff to be able to formulate healthy food and healthy meals. And if someone does have a care plan, that's always something that needs to take precedent to guide the diet and guide the nutrition. But in terms of like congregate meals that are supported by federal dollars, those meals have to abide by the dietary guidelines. So they should have certain elements of health, as the federal policies say. But I do think it's tricky because not everybody wants to eat the same thing, and so there's a lot of thought put into variety, ethnic, different tastes and preferences. So I don't know, Bob has to add something to that.
The only thing I want to add is I'm curious to see how this is going to play out. Again, Secretary Kennedy just recently came out with guidance to hospitals and skilled nursing facilities on what they can serve. Okay, what kind of foods can they and can't they serve? And they're threatening to withhold federal dollars if they discover that these facilities are not meeting what they expect to have the food be for the residents or the patients in those hospitals. And we're not sure what the legal basis of it is. We're not sure, whether it's going to be anything Congress addresses. But until they do something, that the threat of withholding money is a serious threat. And focusing on those specific areas for the food, to me, is very interesting. So there must be something that they have, come upon that makes them want to go this route. So I'll be curious to see how the industry responds and also how Congress responds.
Also, the infrastructure around it, right? The medical schools and how do they pivot to address this as a requirement? Wonderful. One question I have, and it's to all of you. So people who are in their 50s, as they're aging, how do they plan for their retirement in case, okay, they're aging at home, but at some point they need to move into a nursing facilities? What are the things that they need to plan going towards that financially? There's a social emotional piece, of course, but what are the things that someone who is in their 50s today should start exploring in order to plan their senior years, especially if they have to move to a retirement home or a senior living care facility? A question to all of you.
I would just say that there are a lot of benefits and services available to older adults, and they're not always taking advantage of that. So it might be a good idea to think about, like, what kind of benefits can you get? Like, for example, a lot of people qualify for the SNAP benefit. They're eligible, but they're not all taking it for a variety of reasons. Sometimes they feel like they're taking away from others who are less worthy. Sometimes they're feeling they just don't want to feel that judgment about stigma. But there are also Medicare savings plans. So when you get to Medicare, you can have an application to apply for a Medicare savings plan, and that can help you pay for some of your costs of prescription drugs and out-of-pocket costs. There are other things that are available, energy assistance for paying utilities in your home. So I would, if you haven't started thinking about it, hopefully you have savings, but not everyone is lucky enough to afford to save. There are still some supports for supplemental, expenses that you might be eligible for, and it's important to look into that.
Okay. Thank you so much, Dorothea. Anybody else has a quick word in for that?
The only thing I would add is planning. Planning is very important when you're in your 50s, whether it's financial planning or otherwise. And, you shouldn't, and there's a lot of things. I mean, again, it depends on whether you're going involuntarily or involuntarily into a senior living facility. It's a big difference. And so, you ought to think both options out. But if you're doing it on a voluntary basis, spend some time and learn what your options are and, see what best fits your lifestyle.
Thank you, Paul. Laura, Alina, any last words?
Yeah, the only thing I'd add is like looking within a bit and understanding what's important to you. What brings your life meaning and purpose? And what are ways to achieve that? Sometimes we get focused on the medical procedure or where we're going to be living, and we're losing sight of what our real goal is and how best to achieve that goal. And sometimes I joke around with my patients. We talk about physical therapy. I said maybe like some metaphysical therapy would be good too. To just go a little bit deeper and see what it is you want for yourself and how best to achieve it. And some of it is financial planning, some of it is who will your surrogates be, and thinking about that carefully, not just going with a hierarchy within a family. Yeah, Elena, go.
Sorry, no, I didn't want to interrupt you whatsoever, Laura. So I just say that I've got.
No. Let me pass the baton to you.
She agrees with you, Laura.
Okay. Well, in terms of financial planning, I think that would make a really big difference to um, that young adults that we learn that compounding, saving, the power of saving should be taught very early on in high school, even elementary. So then you can see that, if you put, yesterday a colleague told me, when I was a kid in high school, a mentor made me save, I don't know, $600. And now the $600 go to $120,000 without touching it.
Wow.
Yes, it's power of compounding and putting it in
Yes.
index funds, nothing major. So,
Yeah.
but and there is now there is this Indian man who is becoming very famous, Rahit Sethi, with the book. Actually, I have it in front of me. I'll show you. So, this, I will teach you to be rich, whatever. It's
Okay.
a very good book, yeah.
Awesome.
And he teaches younger generations to invest properly and to be very savvy on where you put the money, and 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 everybody should learn. And there are some basic rules, compounding. You put money, you don't touch it. You put $10, $20 every month. Instead of buying a nice jacket, you save. And so, but as soon as possible, as early as you can. And
Wonderful.
that should be taught very, very early on in schools, rather than
Mhm.
other replacing. I don't know. In Italy, I spent a lot of time learning Latin. So instead of learning Latin, teach me how to manage money. So, and how to
So
plan.
important. Yeah.
Yeah.
Wonderful. I love the idea that you all have given pointers for me. Full disclosure, I'm in my 50s, so already thinking ahead and thinking about how I'm going to play this out in the next innings. Okay, thank you guys so much. This was really, really amazing. A very enriching discussion for all of us. I just wanted to go ahead and now invite Mr. Rakesh Kumarji. Rakesh is a dedicated Sewa volunteer who has spent many years serving communities across India and the United States through humanitarian and social initiatives. Since 2022, he has been leading the Senior Seva program at Seva International, focusing on senior wellness, healthy aging, community engagement, and compassionate care for elders. He's here to give a thank you note to our esteemed panelists. Welcome, Rakeshji.
Thank you, Kavitaji, for moderating a wonderful discussion today. And as we come close of today's Policy Cafe session, uh, like heartful gratitude to all our distinguished panelists, moderators, and participants who joined us for this truly enriching conversation. And it was very heartening to see participants asking very relevant questions. And Kavitaji guided the discussion beautifully by asking a wide variety of important questions. And our panelists also shared very detailed insights and experience. Today's session was very meaningful in every sense. And The depth of insights, experience, and policy perspectives and community centered ideas shared today remind us that aging with dignity is not only a healthcare or policy issue, but also a collective social responsibility. And Sewa is doing meaningful work in this area through its Sewa senior programs in the different chapters in different cities. And we'll also share these key inputs that and the learning that we got from today's session with seniors in the different our senior programs.
Chapters, yeah.
Yeah. And so that the value of this conversation reaches to the wider community. And thank you once again to everyone who joined us today. Wishing you all a very, very wonderful day. Okay.
Thank you so much, Rakesh. I just wanted to, guys, to my wonderful panelists, I just wanted to have summarize our discussion today. These are some of the pointers that came out of our discussion today. The first point that has been that we want to address is looking into support options such as Medicare saving plans, prescription cost assistance, utility energy aid programs to reduce financial burden in later years. So this goes to the aspect of planning. Financial retirement planning in your 50s, again, a piece of what we had discussed with all of you about what changes and unexpected life transitions can come to our way and how do we plan for them effectively. Reflect on what brings purpose, happiness, and fulfillment in our lives and make decisions around healthcare, living arrangements, support systems based on those priorities. Building saving habits early in adulthood allows benefits from compounding over time, improving financial security in older age. The future of aging policy must focus on accessibility, affordability, expanded public investment, stable professional support systems, and flexible services tailored to the varied lives of older adults. Local innovation and better coordination and stronger connections between research, policymakers, and healthcare providers and community organizations such as Sewa. So with that, I would really, really thank all of you. We are going to conclude this discussion. Please don't hesitate to send us your questions. If you're in the audience, panelists, today's discussion is part of Sewa's larger journey of dialogue and action across critical social issues. We invite you to stay engaged through our upcoming policy summit in August and explore the senior Sewa through the shared QR code. Join us in building meaningful collaborations that turn ideas into impact. Thank you so much, and namaste from me and from my entire team.
Thank you.
Thank you, guys. Thank you so much.
Thanks very much.
Okay, thanks. Bye.
Bye.
Bye. Thank you. Appreciate your